So today in this video we are going to talk about the Staphylococcus aureus and its various pathogenesis and how it causes its pathogenesis and the various bacterial causes, and we'll also talk about the methicillin resistant Staphylococcus aureus, staphylococcal toxic shock syndrome, its clinical features, and how the staphylococcus causes food poisoning and abscess. And we'll also talk about the other two staphylococcal bacteria that are Staphylococcus epidermidis and Staphylococcus saprophyticus. Now let us move towards the Staphylococcus aureus. So Staphylococcus aureus is gram positive, beta hemolytic, catalase positive, coagulase positive cocci that occurs in clusters. So how it causes its pathogenesis is that the virulence factor of this Staphylococcus aureus is protein A. So the protein A binds to Fc portion of the immunoglobulin G, and after binding to the Fc portion of immunoglobulin G, it inhibits the complement activation and phagocytosis. So when there is inhibition of the complement activation and phagocytosis, there is compromisation in the immunity of the host, and it occurs various diseases that we are going to discuss now. So the Staphylococcus aureus colonizes the ears, axilla and groin. The various pathogenesis, the various diseases that the Staphylococcus aureus does are various inflammatory diseases and toxin mediated diseases. So the inflammatory diseases includes the skin infection, organ abscess, pneumonia, the endocarditis, septic arthritis and osteomyelitis. Whereas the toxin mediated disease, the bacteria causes the toxic shock syndrome, scalded skin syndrome, the rapid onset of food poisoning. So these are the various diseases that are caused by the Staphylococcus aureus. Now let us talk about the Mrsa. The Mrsa is methicillin resistant Staphylococcus aureus. So it is the important cause of the serious nosocomial and community acquired infection. So the resistance is due to altered penicillin binding protein. The Mrsa gene from the Staphylococcus chromosome cascade involves the penicillin resistance. So Mrsa gene is very much important. Now let us talk about the staphylococcal toxic shock syndrome. The Staphylococcus toxic shock syndrome, the various features of the Staphylococcus toxic shock syndrome are fever, vomiting, rash, desquamation, shock and end organ failure. So these are the various Staphylococcal toxic shock syndrome clinical features. The laboratory value associated with this toxic shock syndrome are increase in the AST, increase in ALT and increase in bilirubin level. So it is associated with the prolonged use of vaginal tampons or nasal packing. So compared with the Streptococcus pyogenes, toxic shock syndrome, which is also a toxic shock-like syndrome associated with the painful skin infection. Now let us discuss about the various food poisoning and abscesses that is caused by this bacteria. The Staphylococcus aureus causes the food poisoning due to ingestion of preformed toxin. So it has short incubation period, 2 to 6 hours. So 2 to 6 hours, followed by the non-bloody diarrhea and emesis. The enterotoxin is the heat stable toxin and it is not destroyed by the cooking. So you have to be very cautious about the Staphylococcus aureus toxin. The abscess, it also causes the abscess. So Staphylococcus aureus makes coagulase and toxins from fibrin clot around itself and it causes an abscess. So this is all about the Staphylococcus aureus. Now let us move towards the Staphylococcus epidermidis. The Staphylococcus epidermidis is gram positive, catalase positive and it is coagulase negative but urease positive cocci in cluster. It is pneumovirus insensitive and it infects the prosthetic devices. So the Staphylococcus epidermidis produces adherent biofilms which infects the prosthetic devices. The prosthetic devices could be hip implant, heart valves, and the IV catheters. Now let us discuss about the Staphylococcus saprophyticus. The Staphylococcus saprophyticus is gram-positive, catalase positive, coagulase negative, urease positive, cocci in clusters. So it is novobiacin resistant, and it is normal flora of female genital tract and perineum. So Staphylococcus saprophyticus is the second most important common cause of the uncomplicated UTI. So first uncomplicated UTI in the female is due to Escherichia coli. So this much for the Staphylococcus bacteria. In this video we talked about the Staphylococcus aureus, Staphylococcus epidermidis, and Staphylococcus saprophyticus. I hope you understood this video on the description of this bacteria. So again I am going to just quickly revise those bacteria. The Staphylococcus aureus, Staphylococcus epidermidis, and Staphylococcus saprophyticus all are gram-positive cocci. Staphylococcus aureus is beta hemolytic, catalase positive, coagulase positive, but the Staphylococcus epidermidis is catalase positive and urease negative, coagulase negative. Catalase positive, coagulase negative, but urease positive. And the Staphylococcus saprophyticus is catalase positive, coagulase negative, and urease positive cocci. So this much for today. Thank you.